So my name's Ceri Richards. I am a dietetic assistant for the diabetes team at Wrexham Mila, working for the Betsy Health Board. Predominantly work with patients doing the very low calorie diet. That's kind of where my role lies. And with the video group clinic, I took on the role of group facilitator and clinic coordinator. So obviously, due to lockdown, we weren't able to access quite a large portion of our patients face to face. So it meant contacting them by telephone individually, specifically more of the clinician contacting them directly by telephone. And this was really time consuming. Um, you know, um, and some of these patients required extra behavioral support, more motivational interviewing, and the impact that the diabetes was having, the diet, their weight changes, changes in medication required quite a lot of input from the clinician. So obviously this was really time consuming. So we decided to take a stab at video group clinic and get those patients who are in similar situations, experiencing similar, um, you know, complications and needs with their diabetes, and get them together and put them in a video group clinic. So obviously this was going to save clinicians time, but also give those patients that peer support that within diabetes they desperately need. So yeah, that's what we decided to do. Yeah, so obviously the design of our video group clinic, the patient recruitment part was kind of more the clinician who took on that role, because a lot of these patients had been on the clinician's caseload for a long period of time. They knew them inside out. They knew kind of what situations they were all in, and knew what kind of patients to put together. So obviously in regards to the recruitment aspect, I recruited the patients after they'd been kind of triaged by the clinician, if you like. So obviously my role within that was to call them up, describe the video group clinic, ask them if they were interested in joining a platform like this, which most of them were actually. I think a lot of people over the last year have kind of moved with the times a little bit more and know that video group clinics and being on screen is kind of a way forward within their treatment plans now and what we can offer them. So obviously my role was more in the background of collecting the data for the patient, for the clinician, ready for the session. Collecting blood, up to date clinic letters, looking through their patient notes for their weights and their recent changes that we might need, their medication lists. But I also took on the role of the clinic coordinator, so I also kind of took on the role of making sure that we had the correct details for the patient to be able to join the video group clinic. So in relation to the registration form and the consent and confidentiality process that Redmore have, so having to call and email the patients in order to get the information from them and follow the consent and confidentiality process. And then my role within the actual clinic setting itself was to be the facilitator at the beginning of the session. So in relation to the discussion board, I think it was quite a good talking point and focus on how the video group clinic was going to work. So specifically on our discussion board, we collected weight history, HbA1c history, or recent results. We asked them if they were blood glucose monitoring, because this is vital within their kind of care plan within diabetes, what kind of diabetes medication they were on, if they were on any blood pressures, or and their recent lipid results. I think this was kind of a really good discussion point because a lot of the patients have different levels of knowledge in relation to their diabetes. So some people might not know what HbA1c is, so that gives the clinician an opportunity to kind of explain that on a deeper level rather than over the telephone with one patient. That she's kind of getting to be able to explain that in detail with a few people. And also, like, some patients might know, other patients might not, so it kind of gives the clinician chance to, as I was saying before, that peer support. Those patients that do know can possibly try and explain those to the patients that don't know. And I think it's really, really good with the discussion board as well, because it gives people the opportunity to see where other patients are at, and it makes them feel like they're part of something, that they're not on their own. There are other patients out there who are in similar positions to them. So I think that gives them a sense of, I don't know, just reassurance that they're not alone in the situation. So I think that's really good on a patient perspective as well. In relation to feedback, we got some really positive feedback from patients, especially. Staff, understand how video group clinics can work and can see a vision on how we can slot it um, into our services that we provide as a department. But in regards to the patients, we got some really positive feedback. We got told that it made them feel at ease, and they were able to discuss in a confidential space, which they found really reassuring. I think a lot of them kind of like to be in a group setting because it made them feel like I was saying before, that they weren't alone, but it also made them feel like they weren't overwhelmed, that the group was so big that they didn't want to discuss, so they kind of liked the smaller group setting, and yeah, like I said, it made them feel like they weren't alone, and they realized that there was people in the same position as them. So overall, we had some really good positive feedback that we can definitely take on board, moving forward with the video group clinic. So my 3 tips would be to a clinic coordinator and the facilitator. It would be to be organised and have a clear process on how you're going to go about collecting the data and recruiting the patients, because you do come unstuck at times. Some patients don't get things back to you in time, and it can be quite a long process in order to gain everything that you need to gain for them to come onto the video group clinic. So I think from my perspective, it would be to make sure that they're very organised. If they need prompts to help them remember that they need to gain what they need to gain, then do so. I think also, as a facilitator, when you're collecting all the medical data from the clinician notes previously to get together with the discussion board and everything that the clinician needs for the session, I think it's really important that they know what they're collecting and they understand what they're collecting. So whether they need some training from the clinician beforehand to completely understand, what HbA1c is in regards to a diabetes perspective, what diabetes medication they need, because it just gives you that clarity and know that the data you're collecting is the right data that is needed for the clinician, because I think that's really, really important, because I think it's vital that as a facilitator you understand what you're collecting. As a facilitator, you do have a vital role within the video group clinic, and I think if you don't have that baseline knowledge within the sector that you're working in, it's going to be quite difficult to produce that vision, that discussion board, and ensure that you're getting all the data that's needed for the clinician. So they're my 3 top tips.